Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsor, Aultman Health System. Today, Brad and I are broadcasting from our administrative offices. Our special guests are Dr. Paul Hetchesley and Medical Director of Aultman Patient Rehabilitation, and Angie Eaton, Director of Post-Acute Therapy Services. Good morning and welcome to the show.
Good morning.
All right. We'd like to remind our listeners today our program is available on our podcast. You can find it in your favorite podcast app. Just look for Health Matters with the Medicine Center Pharmacy, and please subscribe to our program. Aultman's Comprehensive Medical Rehabilitation Program is a 60-bed intensive inpatient rehab unit. Their specially trained and skilled staff will assist you to recover from your injury or illness. From physicians and nurses to dietitians and social workers, the focus is to restore function and improve the overall quality of life after illness or injury.
Welcome to the show, Dr. Hetchesley. Please tell our listeners about yourself and about your history with Aultman.
Well, thank you for having me. Happy to be on the show. So I'm kind of a local guy. Grew up in Akron, Forge Lakes area, and did my residency up at Metro Health Hospital in Cleveland. And about 7 years ago, an opportunity came to join Aultman Woodlawn as medical director. So I was happy to have that opportunity. It's been great. Canton has been my home now for about 30 years, and so it's nice to live and work in the same community. It's been a great place to work, and I'm really blessed to be here.
Welcome to the show, Angie. Tell us about yourself and your path with Aultman.
Morning. Thanks for having us. I am a physical therapist, and I have been at Aultman since 2001. I did my last internship of PT school at the main campus at the hospital and got hired on there. And then I came out to Aultman Woodlawn when we opened our campus here in 2003. So I've been here for my whole career, and I've been at this site for a little over 20 years.
Wow. When I look across the street from our office, I can't get over the amount of vehicles parked over there and how many people must work in the physical system in Canton. It's really amazing. So where is Aultman Inpatient Rehabilitation located?
So we are on Woodlawn Avenue, about 5 miles from the main campus. We really have a pretty setting out here, lots of green. So whenever anyone looks out the windows, and there's lots of windows on our campus, they will see some sort of pretty green scenery. We also have an outdoor courtyard where we can do therapy with our patients. We have a gazebo, some elevated gardens, and different surfaces for our patients to walk on. And it's such a nice view out there that recently we had a patient and his wife go to our gazebo to renew their wedding vows.
Mm-hmm. Wow.
Okay, Dr. Hetchesley, what is inpatient rehabilitation?
Well, basically, patients stay here. Average length of stay is about 2 weeks, and it's hospital-based rehab, so it's fairly short term. It's interdisciplinary, so it's kind of physician team-led approach. So there's multiple disciplines. There's a physical medicine and rehab doctor that leads the team, but there's also the physical therapist that we work with, occupational therapy. There's speech therapy, diet, nutrition, neuropsychology. We have specialists as well in different medical fields that work with our patients as well. So typically, our patients are involved and complex with regards to medical issues that need to be dealt with, and then also the physical problems that they have. So we really work together as a team, though. Patients are busy here. They work about 3 hours a day. They have multiple contacts with physicians and therapists and rehab nurses throughout the day. So it's fairly intense, very active type environment. But our goal is always to get people home.
All right. So how does inpatient rehab differ from a nursing home?
So I think the one biggest thing is that we're interdisciplinary. I think in a nursing home setting, yeah, you may see an individual therapist, or you may see a doctor, once every week or two. But here in the hospital-based rehab, there's a lot more involvement, with whatever issue they're having. If they're having trouble with, it's pain or a fracture or spasticity or something like that, the team really works together with physicians and wound care service and the therapist, all to work on those problems together. Whereas in a nursing home, it happens at a much slower pace. You're typically there a lot longer, and you don't have the kind of intensive kind of team involvement that we have here, that I think really makes a difference. Really, people really respond to that, and we see people recovering, and improving pretty quickly with this type of treatment.
My guess is that you're full all the time. Is that correct?
Well, since we enlarged to 60 beds, we haven't been
Oh,
full all the time. But we stay pretty full though. We're quite busy. Yeah,
yeah.
we do have
Wow.
beds available though. Yeah.
Okay.
So, what is the overarching goal of inpatient rehab?
Um, I guess the overarching goal is to get people home. But I guess in lieu of that, I guess the goal is to have people leave us as functional as possible. And whatever it takes to reach that goal. Some people can, we call it modified independent or independent with a device. So if they can be independent with use of a walker, or if they can be independent in the community, in a wheelchair, whatever allows them to be as independent as possible. I think that's really the overarching goal. But for the most part, when people come here, we kind of have to discuss with them about, okay, the goal from here is to go home, and that doesn't always happen. Sometimes people do need more therapy somewhere else after they leave us, but our primary goal is to get people home and functioning in the community as independent as possible.
You made me think of something because we see it in the pharmacy a lot. You see somebody come in and maybe their gait isn't the best. And I know this is different from inpatient rehab, but I'm thinking about you getting a patient in your inpatient rehab clinic, and I'm thinking about it's one thing to provide them with rehab, it's another thing to provide them with that maybe that mindset support that it's okay to use a cane, it's okay to use a walker, and you don't have to feel like you're being judged or whatnot. I just
Yeah.
wonder, I'm assuming you have people on your team that is probably an advantage over a nursing home based rehab setting where you might be able to help people deal with those psychological aspects. Is that a fair comment, or am I reaching?
Yeah, that's very true. Sometimes you'll get a young guy who becomes paralyzed, and you have to really counsel them and give them a lot of support, and
Mhm.
because they're still the same person they ever were. Their mode of mobility might be a little bit different now. Maybe now they're mobile at the wheelchair level, but they're still the same person, and
Mhm.
so people sometimes can really achieve a high quality of life in spite of their neurologic problems. And we do have a wonderful neuropsychologist here that gives us a lot of advice on medication management and supportive counseling and different things that help people deal with kind of adjusting to their disability. But yeah, that's a good question. Yeah, thank you.
What can people expect when they first enter inpatient rehab?
They can expect that they're going to get a lot of attention. All these people that Dr. Schutzley mentioned, we all are working with those patients every day. So when they get here, they're going to get an assessment from their nursing team. Then they're going to meet the doctor and see the doctor. Our doctor's around here daily. Then within the next day, they're going to start therapy. They're going to have physical therapy, occupational therapy, speech therapy assessments. They're going to be assessed for their functional needs and deficits. And then they're going to meet with our social service team and have an assessment with them to determine their support needs. And we are all going to work together to establish the patient's goals, what they want to accomplish while they're with us, and then to help accomplish those goals. Our interdisciplinary team meets weekly to talk about every patient. So we talk about every patient every week to determine what their goals are, what we can do to accomplish those goals, and if anything needs changed in our plan along the way to help them get home.
Gosh, I think 3 hours of therapy each day is a lot. How do people do it? I mean, do they do it right all together, or
It can be spread out throughout the day. You know, we have staff here anywhere from 7 in the morning to 7 at night, and the sessions can be as short or as long as that patient needs. So it can be broken up into small sessions or in longer sessions if that's what they need. We do physical therapy, occupational therapy, and speech therapy. And the thing that I want to emphasize is that we're working on things that patients do every day. So we're working on helping them learn to bathe and to dress, grooming, oral hygiene. We're helping them learn to eat again, to communicate, to get in and out of bed, in and out of chairs, and walking. So it's not that they're down, you know, pumping heavy weights and running on a treadmill. We're doing the functional tasks that we need to do every single day to return to life and to return to home.
Do you provide any group activities?
We provide a variety of different group and fun activities that way. We do some group therapy, which gets our patients together and has them do therapeutic activities in a more social environment, which often engages them more because they're seeing their peers, making friends, enjoying it, and laughing. We also have our nurse aides that do some therapeutic activities in the afternoons after therapy's over, or on the weekends, maybe when they're not having their therapy, to help keep them active and keep them out of trouble. And then we have our dining room for a group dining experience. So we try to get our patients to our dining room to eat, to interact, to encourage each other. And then they make friendships. And sometimes we have, you know, the girls' table over here and the guys' table over there, because they do make those bonds when they're here together for a couple of weeks. And then they'll see each other down in the therapy gym and they're cheering each other on towards their goals. So it's a very good, engaging social environment as well.
Our first break has sneaked up on us already. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Are you ready for vaccine season? Well, the flu vaccine probably has not being administered too often anymore right now, but we do have other vaccines, COVID, shingles vaccine, and others online. You can check in at midshoprx.com.
All right. Can you guys give us some examples of some type of patients you might see in rehab?
Yeah, so we typically see complex medical and neurological patients. Kind of the question I typically will ask is, does this patient require hospital-based rehab? Are they going to require medical management of medical problems that they might have? But typically, a lot of people have medical issues. So what we really look for is complex or neurologic and orthopedic problems as well. Often it's strokes, that may result in paralysis on one side of their body or difficulty speaking or swallowing. Sometimes it's spinal cord injuries. We can handle people with cervical spinal cord injuries like quadriplegics, or also paraplegic patients. So those are people who really need acute rehab. Sometimes it's an issue of something like congestive heart failure or respiratory failure that's left someone with a lot of medical issues, but also some severe weakness, and particularly if they're in the hospital for a long time. So those are the type of people that we typically serve as people that need both medical and rehab attention.
I know this is kind of a hard question, but you mentioned some very complex cases, I'm assuming. What would be a garden variety length of stay for a patient, or is that going to be customized based on their progress and what they need as a patient?
So as Dr. Shetsley said a little bit ago, our average length of stay is around 2 weeks, but some are more, some are less. It depends on the patient. Someone has maybe a little more orthopedic nature might be here a little bit shorter, but some of those complex neuro cases, we need more time with those patients. So last year, our average length of stay was 13 days, and we hang out usually around 2 weeks, but it very much depends on the patient, some shorter, some longer.
Wow.
Do you involve the patient's family or caregivers in the rehab process?
Absolutely. We encourage that. We want the patients and the families and the caregivers involved. We are not going home with those patients. The nurses and the therapists, all the staff we have here, we have to pass the baton to those caregivers. So we want them to be involved throughout the process, whether they might start just watching, observing the sessions and seeing how things are doing. We call it a show and tell, where they can see how they're doing in therapy or with the nurses, with their medications, those kinds of things. And then we want to progress to getting some hands-on teaching them the techniques they need to take care of their loved one, whether it's a therapy handling technique or maybe wound care or an IV they're going to need to provide when the patient gets home. So we want them involved. Sometimes when something happens to your loved one, it feels like you might be trying to drink out of a fire hydrant. There's so much information and you're so stressed, you have a hard time processing it. So we want to try to break it up and give it to you in small doses throughout that stay of a couple of weeks so that they can actually retain and learn and feel more confident when it's time to take their loved one home.
How about specialties? Does Aultman Inpatient Rehabilitation have any specialties?
Yeah, we do. We have cardiology that comes here twice a week. A lot of our patients do have cardiovascular and heart issues, and that's been a big help. They're also available to us by telehealth. We have a neuropsychologist who's able to do cognitive and memory testing, as well as cognitive behavioral therapy or supportive counseling for depression and anxiety and things like that as well. My specialty is physical medicine and rehabilitation. It's also known as physiatry. So I'm kind of specialized to deal with disabled patients and musculoskeletal neurological issues. But we also have medical physicians here as well. Our associate medical director is as a medical physician, and he's been wonderful with helping out with medical issues and dealing with medical issues as they come up and keeping our patients stable. And then we also have some medical nurse practitioners, a couple of them here as well. And then also all the therapy specialties from PT, OT, speech therapy, diet, nutrition, social work, respiratory therapy. So we have quite a varied level of expertise here.
So how's your staff trained to work with these patients?
I did a physical medicine rehabilitation residency. So that kind of trained me to deal with a lot of different patients. Well, a big feather in our cap here, though, is a lot of our nurses have certified rehab nurse training. So that's pretty comprehensive type training where they learn how to deal with bowel bladder issues, skin issues, pain issues, a lot of different things that are related, specifically to a rehab patient. But we have ongoing education. We have an educational director here. We have in-services all the time, lunch and learns. Whenever new equipment comes along, we have group education. So we really have a pretty dynamic learning process. We've got some new equipment lately that Angie will talk about, and we've had some education on the use of that as well. So so it's an ongoing process, that's for sure.
That was my next question. What kind of technology do you use when working with patients?
Sure. So we have some varying levels of technology in the therapy world. We have a Wii where we do Wii sports with our patients to engage them in just different kind of fun activities there, playing tennis or playing baseball or bowling in the gym on the Wii. We also have a system called It's Never Too Late. It's a large touchscreen interactive system with different apps that help the patients work on thinking and reaching and balancing and processing. So that's another item that we get to use with our patients. We have something called Blaze Pods, which they're pods that we can place wherever we need. They light up sequentially, and our patients have to visually track them and then reach to touch them. So that's a little bit more exciting and stimulating than maybe just reach out and touch my hand type of activities. We also have electrical stimulation. Our newest electrical stimulation we added is a BioNest functional stim, which we have units we can put on the arm, which we can get to help them functionally release and grasp objects. And then there's a unit for the leg that'll help them in walking. And then another thing our speech therapist just added is augmentative communication, which is a tablet that she can set up and customize for our patients when they are having trouble speaking and communicating. It can help them be able to touch and make sounds for them to communicate their basic needs. So we try as much as we can to keep bringing in new technology. We do only get a couple weeks with these patients, so we need to optimize our time and engage them in things that are meaningful and use whatever assistive technology we can.
So after they leave you then, Can they come back on occasion for therapy or not?
We typically pass the baton either to our home care or our outpatient therapy teams to continue their recovery, whether it's in the home because they are home-based, or if they're able to go out in the community to go to the outpatient centers, but they'll continue that therapy outside of there.
Okay.
You know, you mentioned the technology about like with the speech assistants. It
Mhm.
really is fascinating, you know, for those of us that are blessed that we don't have a speech problem. It
Mhm.
really is amazing if I mean, just like on your iPhone or whatever, the tools that are available to help people communicate. So I'm sure that that is a huge bridge for some patients, and I think that's exciting that you guys use different tools like that in your therapy to help bridge those gaps, because I can only imagine it's extremely frustrating if you can't express yourself with the ideas you can form, but you just can't get them out. So that's got to be really challenging.
Absolutely.
Yeah.
Let's see here. We're close to our news break, but I'll hit you up with one question before we go, or before we break off. Dr. Schutzley, who else will work with patients in your inpatient rehab facility that we haven't talked about so far?
Yeah, I think we spoke a lot about the different people that work. We definitely keep people busy here. You know, we with everything from group therapy sessions to physical therapy um, um, in uh, in the gym or in their room. We have the medical physicians working together to kind of optimize the co-management, so to speak, of different medical issues that might respond to specific therapy or medications. So it's really a team effort, you know. We have respiratory therapy too as well, which sometimes she'll work on specific breathing exercises. So that's been key as well too. She's been great to help with that aspect as well.
Interesting. Okay, Brad. It is the bottom of the hour, I guess. Time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. I am your host and pharmacist, Paul White. This morning we are talking to Dr. Paul Schutzley and Angie Eaton.
Okay, we've talked about a lot about the inpatient rehab facility so far today and learned a lot. Can the facility handle a medical complication that may arise during a patient's rehab stay?
Yeah, we sure can. We have the ability to do that. It is hospital based, so we can start IV antibiotics if need be, IV fluids. Um, we can manage feeding tubes. And then, like I mentioned earlier, we do have a respiratory therapist here. So if someone has a tracheostomy and they need suctioned or different kind of breathing support, we can do that here as well. Um, if we don't do ventilators here, so if they would need a ventilation support, they would have to go back to the hospital. But otherwise, we're pretty able to deal with most medical issues here. We have lab service here. We can draw labs daily and as needed, and we have what we need to take care of most of our people here on site.
Is it safe to assume that most of the patients that enter your facility come from an admission at the hospital, or is that not necessarily true?
Yeah, most of our patients here do come from Aultman Hospital. Every once in a while, we'll have someone with a significant functional change at home, and they're a direct admission, but that's pretty rare. We also rarely will take people directly from the emergency department, but the vast majority of people do come directly from the hospital to us.
Okay.
Yeah.
So do most patients get to go home directly when they leave rehab, or is it possible they may need to continue to another facility for additional support?
Yeah, around 80% of our patients do get to go directly home from rehab. Some do require some additional support when they leave us to go to another facility, but plan A is always home. That's always our goal when they come to us. Our goal is to get you home, get you back to the community, get you back to your family and your support. We do have to sometimes develop a plan B, but plan A is always home, and that's where we start with the goals from the beginning.
So I assume you can help the family prepare their home for the patient's return. Is that correct?
Yeah, yeah. In therapy, we work on that a lot. We have the ability to recommend equipment that they might need for home, different adaptive or assistive equipment. We can also recommend modifications they might need on their home, whether they need a different railing or different grab bars, or even a stair lift, a ramp, those kinds of things. At our campus here at Woodlawn, we have a durable medical equipment store up in our lobby. So we can take
Mm.
our patients and their families up there and help show them the kind of equipment that they need and get them set up to purchase that. And our therapy team can do home evaluations where we take the patient and their family out to the house, do a test drive or a walkthrough at the house, have them actually get into the home, sit in their favorite comfy chair, go into their kitchen and make a simple meal, go to their bathroom, show us their bedroom, get in and out of bed, do those things they're going to do when they go home so that we can see what they need, make those recommendations, give them a chance to make those modifications before their loved one comes home, and then also determine when they come back and finish their rehab stay, what do we need to focus on? Because when they went home, this didn't go so well. So we want to prep them and solve that problem before they end up at home in trouble. So yeah, we involve the home modifications and assessments and equipment throughout our stay, especially from a therapy perspective.
What about support groups? Do you offer any support groups?
Yeah, we have a stroke support group here on our campus that we have run for years. It involves both our current patients and our former patients who come back once a month and meet with our current patients and their families. So it helps them to see our current patients to see someone who's been there and is now succeeding and thriving. They can talk through things they've experienced, fear they have, and involving the caregivers too. So those families can also say, I've felt what you feel and you're going to be okay. They can give each other tips and support that way. So we have it's twice a month. Once a month is focused on education, and the other time of the month, those when the community comes in and works with our current patients. So we're really proud of our stroke support group. It's thriving. Even we got through COVID, we had to go virtual for a while, which was a challenge. Now we're back in person, and our group is as large as it's ever been.
What about Medicare or insurance? Does it cover rehab?
Yeah, our team will make sure prior to the patient coming here that we have all the insurance pieces, the prior authorizations, approvals in place so that they don't have to worry about any of that. They just have to come here and focus on getting better.
Hmm.
So what happens after rehab?
So we really try to set people up to succeed once they leave us here. It's relatively short term here, only a few weeks sometimes. So sometimes it's just a stepping stone to their long term rehab. Um, we try to set them up to be able to access their home with whatever equipment they might need to be able to get in and out of their house. And then we always arrange further therapy and follow up once they leave here. Oftentimes our patients will receive home therapy once they leave us with physical and occupational therapy, sometimes speech therapy as well, coming into their home to keep working with them in the home setting, on getting around their house, getting dressed, getting to the bathroom within their home. Therapy can help that in the home as well. Oftentimes they progress into outpatient therapy services where they might have to do physical and occupational or speech therapy in the community at an outpatient therapy center. So we really kind of set them up on the course of their recovery. For some of these complex neurologic issues, their recovery is going to be ongoing, for months, after their initial event. So sometimes we're just getting started, but we really put them on the right path and hopefully headed in the right direction with everything they need to succeed and keep getting better even once they leave us.
Hmm.
I'm guessing with both of your levels of experience, you have numerous stories of resilience and success that you might be willing to share with our listeners to help not only, I'm sure it's self-gratifying. I mean, that's what we enjoy most about pharmacy when we help a patient with an outcome. So do you have a couple stories you could share with some patients that really had some tough odds to overcome and were able to push through with your support?
Yeah, I have one in particular, a guy really kind of sticks in my heart, I guess. He was a young guy in his 20s. He got in a dirt bike accident and broke his neck, and he was paralyzed from the neck down, but not completely paralyzed, but you know, a lot of weakness below the neck level. He had been an athlete, you know, had been in a relationship. You know, if I felt like he was at the top of the world, you know, and he really, you know, things were bad for him at first. You know, he required ventilatory support on a breathing machine. You know, he required a feeding tube and everything. And you know, he lost some of his relationships, and it just became very depressed. But we really worked with him a lot. You know, really, you know, in the acute rehab hospital, got him set up with the equipment he needed. And he followed up with me in my office over the next couple years, and you could just kind of see how he just kept moving like in the right direction. And he got back to playing wheelchair rugby, you know, which gave him great satisfaction, you know. And he got a new relationship, and you know, his depression lifted as he became more physical active and back out in the community again. He was even able to get back to work in a modified work environment. He got back to work, and you know, he was in his wheelchair for his work activities, but he was able to get back to work. So it's just you know, it's just a theme I see repeated all the time. You know, it's like we can't define ourselves by our disability or how we get around. You know, that's life is so much more complex than that. And he really, you know, he was able to reestablish just a really fulfilling life again. So it really made me happy.
Cheers. Wow.
Well, that's certainly a lot of resilience, and I think it speaks to as much as the strong mindset as it does your facility and your support. So that's really cool. So excellent. Well, why don't we take our final break and we can come back and wrap up with takeaways.
Okay. You're listening to Health Matters with the Medicine Center Pharmacy. Thank you for joining us today on the Medicine Center Pharmacy's Health Network. I have a question. I happen to have been in Aultman for some testing for a couple of days, and I can't get over the advancement in the equipment, like particularly the hospital bed. I'm thinking, my gosh, this thing is like a Mercedes compared to you know, compared to what they used to be like, and I'm trying to figure out how to operate this and how to operate that and all that kind of stuff. Who decides on the equipment of the general stuff in all of the hospital, your facility, and that sort of thing? How do you evaluate this stuff, and how do you get something that you really want?
We try to stay on top of what's current in best practice or in evolving technology, and then weigh out how that might benefit our patients and their experience with us and optimize their recovery. So I can say from a therapy perspective, we're always trying to do continuing education, learning about new technologies, seeing what's out there and what's available, and then evaluating how that might benefit our patients in our environment. Dr. Setzler, do you have anything you want to add to that?
Yeah, I think that's a good answer. Yeah, right. It's definitely a balance between costs and but then also determining what patients are going to benefit the most from.
I happened to walk into the last year. We do go to the annual event with Aultman Hospitals. Walked into this room, and here's this thing in the corner. And what is that thing in the corner? Well, here it was one of the robots that they had moved to that center or that place, and I thought, holy cow! How the heck could I get underneath that thing? And that's really a scary looking piece of equipment. And it's just amazing that how many surgeries that's being used in. And I'm sure that in your facility, some of the new equipment that has been rolling out is just really fabulous to help people get back to their normal life.
Yeah, we've been really blessed. Our women's board a couple of years ago purchased a bunch of safe patient handling equipment for us as well. So different kinds of lifts that we can use to safely move our patients and decrease their fall risk while also protecting our staff from getting hurt. We were also able to get some ceiling tracking. So there's some tracking in some of the patients' rooms and in the hallway outside the therapy gym, where we can put a patient in a harness and then they're hooked up to some support. So we can do different activities to challenge them, and they're safe, they're contained. So even if they lose their balance, they're not going to fall. They're not going to get hurt. So our women's board was very generous to provide those things for our team here. And it's been great for our patients to be able to do things harder in a safer environment, and for our staff so that we're not getting hurt.
It, well, what do you hope to take away from the show today? What do you hope the listeners take away from the show today? I guess I didn't really know. I thought of your facility as just a place to go, after surgery or after something, but I guess was way out of wrong way on that dude. So, what do you think?
I think my biggest takeaway for today's show would be that we are here. Inpatient rehab is here at the Woodlawn campus. We are active, we are growing, and we're ready to serve. A couple years ago, unfortunately, one of the programs that's on our campus had to close. And when that happened, there was a lot of confusion in the community. All of Woodlawn closed. They're not there anymore. They're not doing their rehab there anymore. But we, fortunately, in inpatient rehab are still here, and we're able to actually expand in follow up to that other program's unfortunate closure. So I just want to make sure people know that we are here. We're growing. We're ready to serve you. We have a great staff, a great growing facility, always evolving our skills and our technology. And we want to be here to serve our community when they need us the most.
So you talked about that gentleman that damaged his neck and was totally paralyzed. I guess my thinking was from years back that with a spinal injury, you were in big trouble. But the fact that you were able to bring that fella back to some extent, then he's working. That is just amazing, and really a terrific thing to do. And spinal, my gosh, all these people running around on these motorcycles and mud bikes and all that kind of stuff. And I'm thinking, oh my gosh.
Yeah.
As soon as the weather got better, as soon as it got a little bit better, the sun came out, got a little warmer, boom, all the motorcycles are out the road, and all the mud bikes and all this other stuff is out in the hills and all that stuff. And I'm thinking, my gosh, what's the matter with you guys? Why do you like mud?
We're able to deal with those complex, neurologic and trauma issues here. We really are. And like you said, in the old days, an injury like that would not have turned out as well, because just some of the simple things, even though they're a lot of work, are life-saving, like managing their bowels and bladder right, and preventing blood sores, and just doing and keeping their respiratory status fit. All those things that we can do here really have a profound impact on people. And just I would want the community and all the surrounding hospitals to know too that we're a regional hospital-based rehab unit that can deal with these complex neurologic and musculoskeletal issues, people that really need a lot of rehab attention.
I like to play in the mud when I was a little kid, but I'll be doggone, I'm going to be out there flying through the mud and having it spraying all over me and all over my cycle and all that kind of stuff.
It does look like fun, though.
Oh, you're one of them guys, huh? Anything else, Brad?
Well, I just thank you both for taking time out today to share what's possible at Aultman for inpatient services. And I guess I just encourage you, if you don't mind, if you could each just give a little bit of a summary of what you have available again for listeners just joining us here at the end, and how to get in touch with your departments in case they have a loved one that could benefit from your services and they want to make sure that they get in touch.
So if you need our services, you could start by just calling our main number, 330-479-4800, and ask to be connected to our transitions team. They would then take all the information to get the process started. You can come in and take a tour of our facility if you have potentially a surgery is coming up. We don't always, the things that come to rehab, patients usually don't know are going to happen. But if you ever have the desire to come see our facility, we'd be happy to give you a tour, answer any questions, do any kind of prior insurance work that needs done, whatever we can do to help make the experience as smooth and the least scary and intense that it can be, we're happy to do that for our community.
Can you tell us where the facility is again?
Sure. Our address is 2821 Woodlawn Avenue. We're kind of diagonal from where Lobies or La Pizzeria are, just kind of back from Belden Village Mall area, about 5 miles from the main hospital in that direction.
Okay.
Yeah.
And you, doctor?
Yeah, I'd like to just reinforce too that if you're at a different hospital or a different facility and you need rehab, don't hesitate to ask your doctor or ask the social worker wherever you are that, hey, I'd like to go to Aultman Woodlawn for my rehab. So because we accept people from many outside hospitals as well in Cleveland and Akron and other places.
Yeah, sometimes an accident might happen away from home, and people want to come back to the rehab center here closer to home to do their recovery. So we, like the great point, Dr. Shetsley, we take patients from everywhere. We have referrals from Ohio State. We have referrals from Pennsylvania. We have referrals from anywhere that people might end up when something tragic happens, but they want to come back home to do their rehab.
Gosh. Okay. Thank you to our guests, Dr. Paul Shetsley and Angie Eaton of Aultman Inpatient Rehabilitation. Anything else?
Happy Easter, everybody.
Ah, yes, and to you. Very good. Very good. If you suspect you have a medical issue, please contact your healthcare provider. Thanks to Aultman Health System and our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you next Friday right here on Newstalk 1480 WHBC. Thank you both very much.
Thank you.
Thank you, Ray. Thank you.
I know you're doing wonderful work. So
Thank you.
Thank you.
yeah.